Alrighty, so today we're going to learn how to properly obtain intravenous access, or otherwise commonly known as IV access. So, have any of you ever been super sick and in the hospital, needed to be rehydrated, or had a little bit too much to drink after a night out?
Yep.
Have you ever needed anesthesia for a procedure or any
Yep.
kind of medication? Okay. Have any of you ever had to give blood?
Yep.
All right, so most of us have gone through one or many of these procedures, and they all include obtaining intravenous access. All right, so proper IV access is vital for effective patient care, comfort, and really to do like most medical procedures. Many of us have experienced painful or unsuccessful sticks, and it leaves us wondering if our medical providers really know what they're doing when it comes to sticking our veins with needles. So as an EMT and an experienced medic, I have done many successful sticks, and hopefully we're going to do one today. So before I walk you through and demonstrate how to do an IV, we're just going to review basic human anatomy of the veins. Now everybody has a different structure of veins, but in general your veins are going to be very similar. Sometimes they're just in different shapes. So according to Anatomy Study Buddy, there are going to be two main veins that you're going to want to hit, and both of them are going to be in your cubital fossa, which is going to be this triangle right here on your inner elbow. The first vein is going to be this vein that's going to run right here, right through the center of that cubital fossa, and that's going to be the median cubital. It's close to the surface, it's not surrounded by a lot of nerve bundles, and it's thicker than the second vein, which is going to be the median cephalac. This vein is going to be right along here. That vein is more commonly used for blood draw because the needle's not going to move as much right here as it is going to be right here. So you bend your arm a lot in the middle, but if you bend it, it's not really going to affect the side of your arm. It's not for fluids because it's not thick or thick enough to obtain the normal saline or the lactated ringers. And it can also handle thicker gauges, which blood flows through faster than the small gauges. So according to our intravenous therapy skills, our alternative site is going to be the basilar vein. And this is going to be right along your ulna, which is going to be right here. And as you can see, if you look at your own arm, you're not going to see many veins there. And so this is going to be our last resort, and that is because it is not visible, and it's also the most painful, and we don't want to make this procedure painful for our patients. For this, my patient and I will both be sitting. It's important for us to be at the same height level, and some people get squeamish with blood, so I don't want him to pass out. Alrighty, so we're going to begin now. Alright, so step one, we're going to put on gloves. This protects me and my patient from any possible chance of body fluid transfer. Next, we are going to place the constriction band. If I was going for the basalic vein along his forearm, I'd put it here, but since I'm going to go for the cubital fossa, I'm going to put it on his upper arm, mid-bicep. So this is really going to restrict the blood flow to the vein, so it's going to make it pop. Second, or third, I guess, we are going to clean the area with alcohol. This prevents any bacteria that's lying on that skin getting into that injection site. So we're just going to clean it, set that aside. Alright, so now I'm going to look and feel for the vein. With his veins, you can't really see them, but I definitely have a vein that I can feel, and then I'm confident that I'm going to be able to stick. Alrighty. Since I felt the vein, I'm going to go ahead and mark it with the back of the needle. This just increases my chances of actually hitting the vein. Alrighty. I'm going to pull the skin tight. This helps ensure that the vein's not going to roll or move on me, okay? Alrighty. See, we have this little flash of blood in here. This indicates that we are in the vein. So I'm going to drop my needle from 45 degrees to 15, advance a little bit, and now I'm going to advance the catheter all the way until the hub is to the skin, if you can see that there. Alright, now I'm going to remove that constriction band so the blood is no longer restricted to that area. Now, I'm going to have to occlude this vein, which means hold significant pressure so that the blood doesn't come out. The blood still may come out though. Okay. Alrighty. Now we're going to insert the saline lock. So the saline lock is usually used for later medication access, later line access, and really just to initiate IV access for patients who are in transport. This is what we call a tachyderm. This is just going to hold that in place. And we're going to remove this. And we now have a successful IV stick. If I were to remove this, I would simply hold pressure here like I did when I was taking out the needle. I would remove this and have the patient bend his arm with a piece of cotton laying here, hold it above his head, and that's going to allow the blood to clot in that injection site. Alrighty. So, important things to remember when you're obtaining IV access is you never leave the constriction band on for more than 3 minutes, because that can cause damaging blood clots into your lower arm or into any part of your body that it is. If you do miss, do not poke the same area. If I were to miss this, I would not aim for the same vein. I'd probably switch sides, and if anything, I'd go to our last resort, which is going to be along that ulna. Make sure you feel for your vein, just like our patient here, Corey. He doesn't have visible veins, but he has very palpable veins, which means I can feel them. Ensure your angles are correct. That's why I was sitting down, because if I was standing up, I couldn't really get a good 45 and 15 degree angle, which is really important to not blow your patient's veins. Valves in your veins. You have these little valves in your veins, and sometimes you hit them. Never force your needle to go past them, because that is also extremely painful. As my EMT instructor always said, the less pain you cause your patient, the more they will trust you and the easier your job will be. And thank you for listening to my speech, and do not try this at home, please. Thanks.